First announcement is that the event tonight is masks are required except for fully vaccinated people up here on stage. So everyone else should please continue to wear their masks. So good afternoon. Welcome to Lehigh's College of Business and the annual Gruhn Distinguished Finance Speaker Series. I'm Nathan Urban, Provost and Senior Vice President for Academic Affairs here at Lehigh University. On behalf of President Joseph Helbley and Lehigh Business, it's my pleasure to welcome trustees, faculty, staff, students, and members of the community. And I would like to make a special welcome to our speaker for this afternoon, Ken Frazier. The college is pleased to bring nationally and internationally recognized thought leaders, such as Mr. Frazier, to our campus to address important business topics of the day. And we pride ourselves on preparing our students for success. And what better preparation than to have students engage with successful industry leaders, especially from areas as important as the pharmaceutical industry today. I'd also like to thank Don and Judy Gruhn, who have made this event possible through their generosity. Unfortunately, the Gruhns couldn't be with us today. The Gruhn Speaker Series, which was established in 2008, is just one example of extending the student educational experience well beyond the classroom that we take such pride in here at Lehigh. Distinguished Lehigh alumni, such as Don Gruhn, from Lehigh's class of 1949, find many different avenues to give back to their alma mater. Don's generosity is felt across this entire campus, from endowing a scholarship fund, contributing to the Financial Services Laboratory and the Martindale Society, to supporting the Zoellner Arts Center, to supporting and journalism and athletic departments. He is a true friend of Lehigh. The Gruhn Speaker Series is yet another way in which Don supports Lehigh. We're deeply grateful for this opportunity to welcome another thought leader to campus. And with that, I would like to invite Georgette Chapman-Phillips, the Kevin and Lisa Clayton Dean of the College of Business, to the podium to introduce Mr. Frazier.
Thank you, Nathan. Please allow me to add my best wishes and gratitude to Don and Judy Gruhn. We really miss having you on campus, and we hope to see you back on campus soon. I also want to thank Ken's wife, Andrea, and one of his two children who are here today, James, who is also a Lehigh grad. Yay. Today's event is part of the Year of Learning. The Year of Learning is an annual College of Business-wide initiative that focuses our students and our faculty on a particular area of interest through classroom activities and campus events. Each year, we choose a theme and we weave it through all of our programs with the goal of enabling students to learn about the topic through many lenses and activities. This year's theme is the corporation and society. I am sure we will hit that topic this afternoon. We have a wonderful program for you. Not only do we have Ken Frazier here with us today, but our moderator is a remarkable young woman in her own right, Shalvi Singh. Let's welcome them both to the stage. Ken and Shalvi. Shalvi has followed Ken Frazier's career and admires his work in the health sciences. And she says she would have been perfectly happy to be sitting in the audience today. But to have the opportunity to sit and talk with Ken for 45 minutes is a dream come true. Shalvi describes herself as on a mission to make health diagnostics connected and available for the poor and the marginalized in emerging markets. Through her telemonitoring startup called Health Engine. Shalvi is a marketing professional with 7 years experience ranging from spirits conglomerate to the graduate program management. I'm sure there's some synergy there. Among other accomplishments, Shalvi has helped over 100 African women get accepted into various business schools as part of the We Believe in You program. Shalvi's company has developed a proprietary aerosol screening kit to detect COVID-19 viral load in less than 1 minute. It has been licensed and it's in its testing phase. Shalvi also happens to be a 1 MBA student right here at Lehigh Business, and she is the recipient of the 2021 Asa Packer Social Entrepreneurship Award. Thank you so much, Shalvi, for taking on the role of moderator today. Ken Frazier and I have literally been working to make this day happen for years. To go way back, we met and became friends when we were both Philadelphia lawyers back in 1987. He graduated from Penn State with a poli-sci degree and earned his JD from Harvard Law School. After years of private practice and becoming a partner at one of Philadelphia's most prestigious law firms, Ken joined Merck in 1992 and rose to become president and CEO, a position he held from 2011 until this past June. He is now executive chairman of Merck's board of directors. Under Ken's leadership, Merck delivered innovative, life-saving medicines and vaccines, as well as adding value for the company's multiple stakeholders. Although when he first became CEO, Ken was faced with a difficult decision: cut research funding or withdraw the EPS, that's earnings per share, targets set by his predecessor. Believing strongly that science was the lifeblood of the company, he withdrew the financial targets. That was probably not the most popular decision at the time. He went on to lead Merck in the development of several novel vaccines and treatments while making unique breakthroughs in immuno-oncology, among other therapeutic areas. He placed emphasis on the company's discovery and translational medicine capabilities through the creation of research centers. Since his day as an attorney, Ken has been a strong advocate for social justice and economic inclusion over the course of his whole career. He is the founder of 110, a coalition of more than 50 companies committed to upskilling, hiring, and promoting 1 million Black Americans over the next 10 years into family-sustaining jobs with opportunities for advancement. This spring, he led the charge to mobilize business executives to support voting rights for all Americans, publishing an open letter signed by dozens of industry peers. In 2018, Ken was named one of the world's greatest leaders by Fortune magazine. In 2019, he became the first recipient of the Forbes Lifetime Achievement Award for Healthcare. In 2021, he was honored with the Deming Cup for operational excellence and chosen by his peers as Chief Executive Magazine's CEO of the Year. And just last month, Ken was again named to Time's yearly list of the 100 most influential people. One last thing. Ken, it says on your Wikipedia page that to make extra money in college, you raised tadpoles and newts and sold them to local stores. I'm wondering whether Shalvi has a question about that. Ladies and gentlemen, let's give our applause for Ken Frazier and Shalvi Singh.
Thank you, Georgette, for that. So, hi, everyone. As you know, my name is Shalvi Singh. So, first of all, on behalf of the Lehigh community, all the students, I'd like to welcome you today here, sir. And without further ado, I'd like to start this whole conversation, which you've already put a lot of pressure on me on. So, the first question I have for you, Ken, is you recently transitioned as the CEO of Merck to the executive chairman. And you took that position for about 10 years. So how has the transition been for you, and what's next for Merck?
So let me start by thanking everyone who came out today, and thank you to the whole Lehigh community for having me here. It has been a relatively recent change. I stepped down as of July 1st. I'm still executive chairman of the company, so I'm still on the payroll. That's a fortunate thing, but I'm also responsible for the strategic direction of the company. I'm also responsible for overseeing the CEO, which I'm sure annoys him a great deal to have me there. But you know, from my perspective, it's a question of now taking a step back from the day-to-day activity, having to put out earnings every 3 months. I won't miss those kinds of things. And to focus on where the company should go in the long run, while at the same time focusing on a number of other things that I have to do. I'm the lead director of ExxonMobil, which is a company that just recently had a challenge around its board composition, and so we're spending a lot of time with 3 people who came in through a proxy contest. And Georgette mentioned 110, which is it's just getting off the ground and scaling up. 110 is a coalition of companies that intend to hire over the next decade 1 million black Americans who lack a 4-year degree. The reason for that is almost 80% of African Americans at age 26 don't have a 4-year degree. Many companies sort of reflexively or through their computer systems require people to have a 4-year degree, whether or not the actual 4-year degree is necessary to do the actual work. So we're trying to get these companies to go from a credentials-based hiring approach to a skills-based hiring approach, because there are a lot of important jobs out there that people without a 4-year degree can do. And it's very interesting that, you know, my daughter is a computer scientist, and if you look at that industry, there are a lot of very brilliant young men and women, but mostly men, who are coders, who never went to school. And we think of them as being brilliant. We think about the Mark Zuckerbergs and the Bill Gates of the world, and we don't think the absence of a 4-year degree has anything to do with their abilities. So our job is to try to get people to be focused on creating opportunities. There's 10 million job positions in this country that are open right now, and if we don't think about training people to take those jobs, then we're actually going to hurt the companies as well as the people.
Absolutely. Thank you. So with that, I'd like to ask my next question, which is, as the CEO of a Fortune 500 company, it's a great thing, right? It's a milestone in itself. But having to be one as a person of color is all the more meaningful. So what do you have to say on some of the challenges that you faced along the journey, and how did you tackle that?
You know, it's interesting that with respect to African American CEOs, if you went back 10, 15 years, there were actually more than there are now. I think now that I stepped down, I think out of the Fortune 500, there's 4 companies that have an African American CEO. And I think even the most pessimistic observer would have thought the number would have been greater at this point. So the challenges I think that are associated with this, and at least in my own experience, are twofold. One is the whole question of unequal opportunity, and that starts where, you know, people here at Lehigh are very fortunate. They are getting an education in one of the finest institutions in the world. But just as I just talked about a few minutes, a large number of people who are African American descent don't get that opportunity, don't get the 4-year degree, do not necessarily get the right kind of education, K through 12. And then even if you control, and this is the main point I would make, even if one controls for education and economics, inside a corporation, some people have more social capital than others. And that's for a whole host of reasons. Women tend to have less social capital than men. Minorities tend to have less social capital than often their white peers. And so trying to ensure that you even out for that social capital, or another word that you could use is social networks. LinkedIn did a study recently that shows that when companies promote people to senior management or to their boards, the first step is to gather a bunch of people who have the qualifications for that position. But after you assemble those people, often the actual decision is made on social networks. So as long as social networks play a major role in getting promoted to the top of companies, then people who are not necessarily close to the people who run the company because of, let's say, gender or race or whatever, they have a disadvantage that they have to overcome.
Right. And a follow-up to that question is, if you could tell us about an incident or a person that influenced you to become who you are today in your formative years, specifically, who and what would that be?
Well, I'll try to. So the first person and my wife and son are here, I want to acknowledge them too. My son came from New York, so he really wanted to hear this boring speech over and over again. He hears it all the time. So it's on you, James. The person that I would point to most importantly in my life was my dad. My mother died when I was very young, so I had the experience of being raised by a single parent father who wasn't very sentimental about his children. He was very tough, but he gave me the best advice I'd ever been given in my life growing up in the inner city of Philadelphia, which was, you had to be your own person. You had to have your own goals and your own desires, and you couldn't be influenced by peers. He actually put it more succinctly when he would say to me, Kenny, what other people think about you is none of your damn business. And the sooner you realize that, the better off you'll be. So that was the first person. I would think as a role model, as I was growing up, the person that I admired the most was now late Justice Thurgood Marshall, who was then not Justice Marshall, but who led a bunch of lawyers who essentially used the law to break down customs and laws that segregated parts of this country, particularly in the American South.
That's interesting. So Ken, now enough of all these questions. Let's address the elephant in the room, which is what happened in 2020, the pandemic.
Right.
So when something as big and seemingly unsolvable as SARS-CoV-19 hit, the world was looking at life sciences companies such as yours to come up with a solution. What was COVID-19 for you, and what was Merck's and your particular response to address that, and how would you describe it?
So I would say this, obviously no one was prepared for this, and we could talk about the fact that as a society we have to be prepared for the next pandemic. It may be another virus, it may be it might be a bacteria the next time around, but we know that the world is getting smaller, that people are methods of transportation are such that a disease is unlikely to stay in one place. We might remember, for all of us, when we first heard about the Delta variant in India, that was only just a few months ago. It was sweeping through India, and people were starting to isolate a few cases in the United States, and within 3 or 4 months it had become the dominant strain in the United States, which reflects the fact that the world is small and pathways of transportation are quite open. So I think when we first heard about it in late December, early January, I think a number of people began to ask, is this the kind of virus that's going to spread globally? We had seen other coronaviruses, SARS, MERS, before. They tended to be regional in nature. But the most important thing was that our NIH went and isolated the spike protein and provided it to lots of companies like Merck to begin their work on vaccines. And so Merck endeavored to do 2 different vaccines. We have a particular platform that has been successful for us. We use a measles platform, another platform that we had used recently to make an Ebola vaccine that had been effective. And we went to use those platforms because those were platforms that were based on viruses that replicate. And our goal was to create a single-shot vaccine that would be durable over a long period of time, that would be robust against mutations and variants. We were unsuccessful in both of our platforms. Our colleagues at Moderna and Pfizer BioNTech, as well as Johnson & Johnson, were very successful. They brought forth vaccines that have actually made our lives a lot safer, and although we're all still wearing masks again in this country. And so at that point, we decided that we would help Johnson & Johnson. So I picked up the phone and called the CEO of Johnson & Johnson and said, our vaccines didn't succeed, yours did. We have manufacturing plants that we could make the J&J vaccine, and so we devoted to 2 of our production facilities to do the J&J vaccine. And then last week, our antiviral researchers were able to announce that we've developed a pill for COVID-19 that could be taken early in the disease, which is very important because obviously we have good medicines like the monoclonal antibodies from Regeneron and Lilly and other companies, but they tend to be used for people who are later in the disease, and they tend to be administered in the hospital, so they're not necessarily as useful. I think everybody wanted to have an oral medication that would be easy to use at home. When people first got the disease, and hopefully that will be approved at least under an emergency use authorization by the FDA soon, and it can be used by people sort of like a Tamiflu is used when people first have symptoms of flu.
Right. So with that, you've already addressed the next question that I had, and how can we not ask this? We have all seen the headlines Merck has been making in the last 3-4 days, literally flooded with the news of the new antiviral drug. So my question to you, Ken, is what do you think would be the next step once the approval comes into place? Because there are so many eyes watching over it, and so many claims have been made. So in terms of price point, in terms of its adaptability in general, but what are your views on that?
So I think clinical medicine will decide how to use the drug. I would say very clearly, vaccines still have to be the first line of defense. Simple fact of the matter is Dr. Fauci reminds us the best way not to get sick from a virus is not to get infected with the virus, and that's what the vaccines do. But if one does become infected, we do need treatments. And so we think this is the study shows that people who take this drug within 5 days of feeling symptoms are 50% less likely to go in the hospital. And also importantly, the people who were on the drug arm of the test, there were no deaths versus 8 on the comparison arm. So it seems to have an important role to play. We've said that we can make 10 million courses or treat 10 million people this year. Obviously, that's got to go way up because the simple fact of the matter, and I'm not here to advertise for the drug, but the challenge that we're going to have globally is that there's 7.5 million people who share this planet with us. That 7.5 billion, did I say million? 7.5 billion people share this planet. Only 1 billion or so live in the US, Canada, Japan, Western Europe. So 6.5 billion people on the planet live in areas where vaccines are not easily transmitted. And so while they're useful vaccines, we know that we're seeing waning immunity after 6 months or so with these vaccines. We're seeing the need for boosters, both because of waning immunity as well as the variants. So I think we don't yet have the kind of vaccine that can be used globally. And so these kinds of medicines, pills if you will, can be made and sent to places where they don't have to be thermal stable, like a vaccine has to be either refrigerated or frozen. So we think this could play a very important role in the world, but we need the FDA to approve it first, and I don't prejudge what the FDA will do.
We got you.
Although the data is pretty good, I will say.
Okay. Ken, tell me something. If there is anything which has evolved more frequently than the virus, at least in my opinion, it's the narrative around vaccines. And now that you've touched base on that, how do you think we as a community, as a conscious community, can counter the organized resistance that has come for vaccines and their usage, primarily the anti-vaccine campaigns?
Well, let me start by saying this is not new. For those of us who are in the vaccine business, and I see my colleague John Taylor, who worked with me for years at Merck. It's good to see you, John. We've been dealing with this issue going back to the 1990s. It used to be that if you told people to take a vaccine, they would take a vaccine. Just by way of context, in 1905, the United States Supreme Court decided a case involving a Massachusetts minister who claimed a religious exemption. And the United States Supreme Court said back in 1905 that that minister had to be vaccinated despite his religious objections. And the justice who wrote the opinion made the point that if anyone has freedom, we have to have freedom from someone else infecting us. That's 1905. And the point about that is everybody associated with that case, the minister who objected, the health authorities in Massachusetts who insisted on the vaccine, the Supreme Court justices, everybody is gone now. But the fact of the matter is, smallpox is gone too, all right? And so what we want to make sure of is that while we need to respect people, we need to have exemptions, for example, for people who can't take the vaccine because they have a compromised immune system. I think we're going to have to figure out ways of convincing our fellow citizens that the reason they need to take a vaccine, and by the way, I was asked this question, I was down with about 60 Congress people last week, the so-called problem solvers caucus. if there is a problem solvers caucus in Congress, you could ask whether that's a misnamed thing. But some of the Republican representatives said to me, isn't this a civil liberties problem? How can you make people get vaccines? Remember, I just told you in 1905, we had no problem with that, with smallpox. But I was saying to the person that the reason why people have to get vaccines is because there's some of us who are on chemotherapy or we have an immune system that's compromised. Those people can't choose to protect themselves from the virus. So those of us who are able-bodied need to do that because we have to protect one another. So I don't know how to answer your question because we have social media and I read the things that are on social media, and if you believe what's on social media, you know, these vaccines are harmful. You know, our company made an anti-parasitic that was used for river blindness. It's called ivermectin. It's being used widely. I can't understand why anybody would think that, first of all, they shouldn't think that they're a horse or a sheep. And they also ought to think that a virus is not a parasite, so just take an anti-parasitic drug. But if you go on social media, people swear that the drug works. In fact, when we came out with our new drug, people started sending emails saying, you just came up with a new drug because you didn't want us to use the older ivermectin because it's generic. This is all a big conspiracy. So I don't know how to deal with this issue. It's a bigger issue around social media. It affects our politics. The fact of the matter is we can't agree on facts anymore in our country.
I mean, to your point, I think flat earthers exist, and so do anti-vaxxers and everyone else who wouldn't believe in the establishment.
Also, one more thing, we have to respect people. We can't just say they're crazy. That's no way to persuade people of something. If people honestly believe something, we have to engage them respectfully in a dialogue, but I'll go back to what I just said. Facts are facts. Science is science. And not everything that people choose to believe makes sense. You know, I have people say, you know, vaccines have microchips. Someone said that to me recently. You shouldn't get a vaccine because it's all a way of keeping track of you. Now, the person has an iPhone, so like we could keep track of them anyway. We don't need a vaccine to figure out where they've gone. But we also have to recognize that there's a legitimate amount of fear in our society now.
That's true. So with that, Ken, tell me, what has been your COVID story in terms of shifting from your daily routine to, you know, acknowledging something else altogether? How has been the work from home culture for you, and has it worked for you?
Well, so we got vaccinated, and when it first happened, I think my wife and I, you know, we stayed together for about a year. Until I think my son came home for Thanksgiving or Christmas, I can't remember. He was the first visitor we had in our house in like a year. And we almost didn't let him come home. But he had been vaccinated too. But the fact of the matter is, so for a year, we had no company. The only other company we had was, you know, whoever was talking from the television at us. But over time, you know, we just realized that you have to get into the world. And as more and more people got vaccinated, we got in the world. I will say that's not totally true. I started going back to work after about, was it spring of last year, April or May? Because at Merck, we have a lot of people who even before there was a vaccine had to come to work because they're in manufacturing and people needed their medicines, or they're in research and they had to do the research activity. Our office workers were not there, but I felt as CEO, if those people were showing up to do their work, every once in a while I should show up in the cafeteria too, because, you know, I'm no better than they are. So I started going to work, my secretary started going to work. We were the only two people in the office building for like 6 months. And at the end of the day, I think there was a lot of excess fear. If you're vaccinated, you're probably okay, as long as you take a few precautions like wearing masks.
Thanks. So Ken, moving on to the next segment, this space particularly intrigues me a lot. Tell me, what are your thoughts on the massive health divide which exists in the US? What is the responsibility of a drug company to make drugs more accessible and affordable? And what is your stand on that?
Well, that's a really good question to ask any drug CEO. So there is a huge divide in our country about healthcare access. It's not just pharmaceutical access, it's access to healthcare. And it's really important to recognize that many people in our society don't really have access to meaningful health care. And a lot of what we spend on health care as a society, we spend on emergency rooms, and we spend on people who've gotten so sick that their acute illness costs a lot of money. But to answer your question about pharmaceuticals, I think the challenge that we have as a pharmaceutical company is that we have to think about balancing two things. So when I'm thinking about pricing a new drug, and we have a drug for cancer called Keytruda that's working across multiple tumor types. It's the first broadly applicable drug that can be used in oncology. When we brought that drug to market, we had a hard question to ask ourselves. How much are we going to charge for it? I'll tell everybody it's about $150,000 a year, which is a lot of money. But we also looked at what the previous treatments were, and they were about $150,000 a year. So we got ourselves to a place where we said, if we're replacing this current standard of care with a better drug, we could charge at parity with what existed before. Now, if you don't have the right kind of insurance coverage, $150,000 is much too much for any individual to actually pay. So the challenge is, how do we optimize access for patients while at the same time providing our shareholders with what they consider to be an adequate risk-adjusted return on their investment? And so I talk about those two things as how do you balance, how do you optimize, not how do you maximize access or how do you maximize profit, because at the end of the day, our company is not here simply to be a vehicle for wealth creation.
That's a very interesting statement that you just made. So Ken, tell me something. What's your take on drug pricing? Because we kind of touched based on that. And you talked about the cancer drug. Do you think life-saving drugs should cost as much?
Absolutely, they should cost that much. And I'll tell you why. So first of all, let me put some facts on the table. It is clear that Americans pay more for drugs than any other country in the world. It is also clear to me that many Americans can't pay for drugs. I would also make the point that often does not come up in the discussion, that the challenge around affordability of drugs isn't simply a question of drug pricing. It is to some degree a question of drug pricing, but it's also a question of benefit structure. So what do I mean by that? So for someone who has a normal health plan in this country, if you go in network for a hospital or a physician visit, you're going to pay 3 to 5% of the negotiated lower price that the managed care company does. For drugs, people pay 20% of the higher list price. So the copay that you pay is a function of not just the list price of the drug, but how much of that is actually insured. So often people look at that copay and they say, my God, how could it be so high? And that's a big problem that we have. I'm not here to say that drugs are not unaffordable, because they clearly are. I think the challenge is, how does the richest country in the world manage to provide necessary health care to people in a way that also allows innovation? Because what we haven't talked about on the other side of the equation is, every year I allocate capital between $10 and $11 billion to my research organization. When you look at the work that we do, 95% of the time we fail. Our business is different from any other business. You know, I have a lot of respect for engineers, but if you look at, for example, the fact that we sent 3 privately funded spacecraft into space. People debate whether it's the outer atmosphere or actually space, but you get my drift. We now have private people going to space. That is a hard, expensive, complicated thing to do. But the rules of physics are more understood. They're more generalizable than the rules of human biology. So what we do, I talked about the 2 failures on the COVID vaccine. 95% of the time we fail. And that's 95% of the time that we start to put things into the clinic. So what I often say about why the drugs seem so expensive is, in a business where you have 95% losers, the 5% have to pay for the cost of the losers as well as the cost of the next series of things to be researched. So I think we've got to find a way to make drugs a lot cheaper. It's funny, on the way here, Andrea will tell you, I was on the phone with my home state, Merck's home state senator, Senator Menendez, who's pushing very hard for what people call Medicare negotiation. Why is it that the Secretary of Health and Human Services can't negotiate drug prices? Well, the simple answer is there is no such thing as government negotiation, because if you actually look at the bill, what they say is if you don't accept the price, you pay a penalty of 95% of the price. Well, that's a little different from what I call negotiation. The government actually has a gun to your head, and so we're saying that if we're going to have innovation, we can't have that. So the challenge we have, to summarize it, is we have to find a way to get today's medicines to today's patients, but have the capital to find tomorrow's drugs for tomorrow's patients. Because the people that actually support the current system more often than you would think are patient groups. But they're patient groups for things like Alzheimer's or Parkinson's, where there isn't a good treatment. They're hoping that there will be enough money to put in R&D to find those treatments one day.
Brilliantly put. I think it's also about, as you mentioned, what goes inside. A lot of the times people look at the surface and don't realize, you mentioned 95% of the times you fail. And I think that's, Ken, Frazier, for you, as one of the companies which only made success after the pandemic, you acknowledge that there were more failures than successes. So I think that's the honesty that we need in today's time. With that, Ken, I'm asking this question to you as an entrepreneur myself. Given the barriers to scale and the barriers to entry into the healthcare sector, how do you think healthcare startups such as ours should survive and thrive in these times, especially after the pandemic?
I think there's a great opportunity for healthcare startups like this. So the life science business requires a huge amount of capital for the reasons I just stated, because science is unpredictable, it's mostly going to fail, but there's a lot that can be done in healthcare that's not specifically the search for the invention of a new drug. Right? In fact, I would make the point that all the great things that happen in our laboratories, the most important things that are going to happen in healthcare are not going to happen in laboratories. They're going to be finding ways of getting the right healthcare to people who don't get that healthcare today. So let me give you an example. The number one health problem in the United States is mental health. There just are not enough psychiatrists to give mental health. In fact, if you look at the state prison population, over 80% of state prisoners have a mental health condition. So we're using the state prisons as mental health facilities. So the question becomes, how do we use technology, for example, to get people in a self-help context the help that they need? Because we'll never have enough psychiatrists, because the number of people who have mental health issues, anxiety, things of that nature, continues to climb, and it just skyrocketed during the pandemic. And we're not going to have enough people to provide that kinds of hands-on help. So how do we actually create access through technology, right? So telemedicine advanced 10 years during the pandemic. People don't necessarily have to go to the hospital. How do we make healthcare more patient-centric and less provider-centric? Those are the kinds of things that I think startup companies are going to do. Let me give you a couple of analogies. Does anybody remember when you had to go to a print shop to print something? Does anybody remember when you used to have to take a roll of film to some place to get it developed? So why is healthcare such that you have to go to a hospital? I mean, what's that all about, right? We can find ways through technology to give people access to care and to help them engage in self-care.
That's a great piece of advice. Thank you. Ken, tell me something. As an advocate of the term corporate soul, I was reading up on a couple of interviews, and I was appalled to see that a CEO is talking about this term so much. What exactly does that mean? Can you let us know? And how should companies especially try to have that in these times?
So I think that, first of all, people look at companies from the outside as though they are inanimate objects. Companies are full of living, breathing human beings with beating hearts. And what I was talking about, was particularly with respect to Merck, is that if you went back to 1952, the CEO of Merck then, who was named George W. Merck, was on the cover of Time magazine because Merck was a tiny little company, but he made a statement in a medical school graduation in Virginia in which he said, medicine is for the people, not for the profits. And the more we've remembered it, the better off we've been. Time magazine thought that idea in 1952 was so important that George W. Merck was put on the cover of Time magazine. Now for you, Time magazine may not mean anything, but for you younger people, that's like somebody being on everybody's cell phone on every social media site at the same time, okay? And he said that because what he was saying is that there's a purpose in the company. And when I use the word soul, I mean people have a deeper purpose. At Merck, our company exists to alleviate human suffering. That's what it exists for. Now, our stock trades in the market based on our ability to actually create shareholder value, and we must create that shareholder value. But that whole purpose of alleviating human suffering is what I'm talking about when I say the company has a soul, because I have 20,000 people in my research laboratories, and they get up every day. They don't say, how do we make more money? They say, how do we alleviate human suffering?
Let's take a moment to grasp what exactly you said. That's so meaningful and deep. Ken, you did talk about this in the beginning, but can you tell us a little bit more about your latest initiative with Jefferson Health and 110, and how does that come about for the African American community?
So on the Jefferson thing, as my wife and I have invested substantially in building a healthcare center in North Philadelphia on the borderline of 2 zip codes that have the worst incidence of stroke in the city, and it's like 20 times the national average. So again, that's an example of there is no health care in that area. And it's not just a question of putting bricks and mortar and putting doctors in an office. It's addressing what are referred to as the social determinants of health. The reason why people are unhealthy is not simply because of the lack of medical care, it's because of nutrition and diet. In that area of the city, it's called a food desert. There are no supermarkets, so people eat processed foods, they eat fast foods. They become addicted to sugar and salt and all those kinds of things that are put in fast foods in order to make them appetizing. But they don't have healthy foods. They don't have access to fresh produce and vegetables and fruits and things of that nature. So nutrition's an issue. Education's an issue. Because if people get a good education, they tend to live healthier lives. Employment is an issue. Housing is an issue. So if we don't sort of thinking about these issues, I talked about mental health being the #1 healthcare issue in the United States. The #2 one is diabetes. It has everything to do with nutrition. The #3 one is pain management. So there's a lot of pain and trauma out in the world, and we felt like if we could invest in that neighborhood, and we also got Temple University Medical School and Hospital and Jefferson Hospital for the first time to do something together because they consider themselves to be competitors. But the 3 of us came together and we said, we're going to build something in that area that allows people not simply to be treated for diabetes, but to live healthier lives, to teach healthier habits so that there'll be fewer people with diabetes. Because, for example, if the parents are putting good food on the table, the children will get better nourished. So that's that. 110 we talked about before, that's the whole issue around skills-based hiring, and we're hoping that we'll change the paradigm in corporate America so that people who are talented but didn't necessarily get the opportunity to go to a great school like Lehigh don't necessarily fail to, not only, the point of it is that they should be able to have a family-sustaining wage, and they should have career advancement even though they don't have a 4-year degree.
So I think we have almost come to the end of this beautiful discussion. One question I have for you, Ken, is what does Ken Frazier want to do now? Do you plan to achieve something more now with all the legacy that you have, or planning to enjoy the finer things in life?
Well, I don't think the two things are completely inconsistent, I hope. I'd like to have a little enjoyment, but I have to say I still feel young. I still feel an opportunity to make a contribution on things like 110. I'm ready to move away from the day-to-day grind of running a publicly traded company and having to do reported earnings every 90 days. But I don't play golf. I don't play tennis. So I'm looking for something that's meaningful. I don't know what that is, but I'm hoping for another chapter.
Wow, that's such an interesting thing to say. And my last question, Ken, is If you have to summarize your journey in a word, if you would like to, what would that word be? And my follow-up question is, if ever your biography is written, all of us would agree we'd love to read that, and we cannot wait to know what the title would be. So if there's one in making, you can let us know now. This could be the reveal.
There's none in making, right to say. But I would say that I would either say I was very fortunate or I was blessed.
Wow. That's, I mean, I cannot say there could be any more humble end to what we have actually spoken about right now. Thank you so much, Ken, for taking out the time to speak to us today. I was the representative for all the students out here, for all of us who are aspiring to become someone in our respective journeys. And I hope we all take with us what we discussed today and what you told to us about the healthcare industry. So with that, thanks a lot.
Thank you.
Yeah? Sure. Okay.
We're going to get some hard questions.
Yeah, right. So now's the time where I would like to invite all of you to ask questions, give your thoughts. We have 2 microphones on either side. I do ask that you come to the microphones to ask your questions because this is being live streamed, and so we want the people that are watching us remotely to be able to hear the questions. So while you're all formulating your questions, I'll kick us off. Again, I want to go back to something that we mentioned in the introduction, which was a very hard decision that you made, where you did put people over profits very, very early in your tenure as CEO. And from a leadership perspective, I would assume that that took incredible courage. Could you tell us about how you came to make that decision and how you handled the backlash that followed that decision?
Well, let me start, Georgette, by saying I wouldn't call that incredible courage. Incredible courage was walking across the Edmund Pettus Bridge when there were state troopers on the other side. But what I would say is that when CEOs are put into these jobs very early, you don't have a track record with your board. You don't have a track record with your investors. And so when I took over the job, I realized that the company had made a pledge, a 5-year pledge around earnings growth. Only 1.5 years of that 5 years had elapsed. The challenge that I faced was that given the way the company was situated at that time, in order to stay on that roadmap, if you will, towards the EPS goals, would require pretty large and indiscriminate cuts in the research budget. And Merck sees itself as a science company, as a research company. And once you do that, you've changed the soul, you've changed the culture of the company. You can't come back a year later and say, oh yeah, but we're really a science company, but I put the investors in front of you and I laid off a bunch of scientists. So for me, it was scary in a way because, you know, I didn't have a track record. I remember having a meeting with my board and telling them that I intended to do that, and they said essentially, you intend to do what? Because obviously the stock was going to get hammered by doing that, and the stock did get hammered. But what I learned that I wasn't smart enough to know at the time was that the people who sold off the stock, for every seller in the market, turns out there's a buyer. I didn't know that before. And the buyers,
You need that Lehigh MBA.
There you go. The buyers actually believed in what we said we were going to do. So while it was painful to watch the stock price go down over the first couple of years, looking back on it, we actually got the right investor base for Merck because they invested in a company knowing that we were going to take the long view, we were going to do R&D, and we were going to try to create drugs that made a difference in the world. So it was a good fortune. And I would say that the reason that I was able to do it, frankly, is I had a mentor, Roy Vagelos, who taught me everything that I needed to know about the job. And what he told me ultimately is that the job of the CEO of Merck is to never do anything in your office that would make it less possible for some brilliant young scientist out there to come up with the next important drug.
Great advice. Okay, questions? We'll start on this side.
Okay. First of all, thank you. This has been sort of a great conversation. So related to your previous response and to some of the things you said earlier, my question is, who should pay for innovation and who should benefit from that innovation? I mean, you took the responsibility saying that Merck should pay for innovation and benefit from innovation. At a university, we have a viewpoint on some aspects of who should pay for innovation, who should benefit. And in our current environment, Pfizer and Moderna and J&J are being encouraged to give away some of their innovation so that there can be, so that these vaccines can be made in other countries, et cetera. I'm curious as to your perspective on this, the two sides of this coin. Who should pay and who should benefit?
So let me start by saying that it's pretty clear that the best way to create innovation is through the private sector. I think that some people want to run the experiment again. I once had a conversation with the President of the United States, President Obama, who was complaining about, the drug pricing, and he's sort of being hard on me, saying people think drug companies are greedy and that's a problem. I said the other problem is that other than, quote, greedy drug companies, nobody comes up with drugs. So the fact of the matter is that the capital markets are the best way to create innovation. The problem with the capital markets is they don't go to church on Sunday, and they don't go to synagogue on Saturday, and they don't go to mosque. They say, bring me my return on investment. And I think if you look around the world, you don't see in those socialist countries innovation, whether it's drugs, whether it's IT, any area of our society where we see real innovation, right? Entertainment, right? I mean, these are the things people come to the United States for. They come for aviation, they come for biopharmaceuticals, they come for entertainment, and they come for Silicon Valley. And those are the places where innovation happens. So I think that's how we innovate. How do we now pay for it? That's the harder question, right? It seems to me, how do we spread the cost of it so that those Americans or people, citizens who can't afford to pay for it, are still able to get access to it? And I think that's the challenge. That's a shared responsibility that we have. If you looked at our press release about this new drug, one of the things I'm proudest of, and you can look it up online, is when we announced this data of this new antiviral medicine that we're coming out with if the FDA approves. We also said that we've already arranged with a number of generic manufacturers so that they could manufacture this drug in 100 low or low middle income countries in the world. So we don't need to profit to prevent people in Africa from getting it or people in Southeast Asia from getting it. But if we're able to do that, somebody has to pay the capital markets. And the only thing I will say, that, and this is a very unpopular thing that I sometimes say, the only thing worse than Americans paying more than everybody else for drugs is Americans not paying more than everybody else for drugs, because then there would be no drugs.
We'll go over here.
I don't know if this works. Okay, it works great. Thank you so much for your sentiments. I have to mention, my name is Cedrico Casa and I'm a freshman in the College of Business. I have to first start by mentioning that I'm originally from Kenya because it's going to factor a lot in my biases in the sentiments and questions I share. So from a lot of what you shared, you clearly understand the importance of investing in R&D and education in a sense. From where I am standing, a lot of the work that I have been doing, because I run an educational nonprofit in Kenya, and we are essentially looking to see how we're going to improve the quality and amount of scientific R&D conducted on the continent to intellectually understand the root causes and drivers of a lot of the problems that are specific to the continent and curate solutions that are homegrown and context-specific. So a lot of the issues that we've been noticing on the continent is we represent 17% of the global population. Yet the research output on the continent is less than 3%. So when COVID hit and the pandemic was there, we could not manufacture vaccines and drugs for our own people. Healthcare access, which is an issue that you mentioned strongly, and access to medicine and primary healthcare facilities, is a big issue on the continent. The types of solutions that would work for American citizens here and in the global north would not exactly be applicable in Liberia. Because in Liberia, for you to get drugs to someone at the very last mile, you need to really think actively about how you're going to develop logistics to serve that purpose. For you to be able to educate doctors in Ethiopia effectively, and scientists, and equip them with the right resources and capacity that they need, you need to be able to understand how exactly do you stimulate structural transformation within that context. So essentially, I'm asking for low and medium and middle income countries that really need to invest a lot in terms of significantly improving their R&D capacity to solve a lot of the problems that are specific to their context. What role should the private sector play in this process in its entirety? And what role will the private sector here in America should or should it not play any role significantly?
So that's an excellent question. And your comment about the last mile is one that actually is really important. We talked about the lack of access in my old neighborhood in North Philadelphia. There's a last mile issue right there in North Philadelphia too. So I'm very concerned about disadvantaged people and that issue around how do you get those solutions to them. Your question's a very broad one, but I'm going to tell you that I think this is where public-private partnerships have to come into play. A company like Merck can't possibly fund the work that you're talking about because we have to get a return to our shareholders, but we can help. And the question becomes, how do you get the World Health Organization, the UN, other countries to work on these issues with people? One of the things that we try to do at Merck is to devote a certain percentage of our research budget to neglected tropical diseases so that we know that we're doing work on malaria, for example. That can't be 50% of our budget, even though that's 50% of the world is neglected, because we have to get a return on investment. But at the same time, I think rich countries have to ask themselves how they're prepared to step in. The other issue that's like this is climate change, right? If you're in the United States of America, you can say, let's cut back on fossil fuels. Because when we go on vacation, we like to say, I'm going off the grid. Well, half the world's trying to get on the grid. And their view is, wait a minute, we didn't cause this global warming problem, but we want to have human development in our part of the world. So the only way that you can do that, if you're going to try to get people to use renewable energy in Africa, for example, is we're going to have to subsidize it. And we're going to have to subsidize that research if it's ever going to happen. I think the other challenge, though, at the end of the day, is it's not just financial resources that we need. It's making sure that the best and brightest in Kenya and Liberia get the very best training in order to go back into those countries and deliver the kind of care. I'll just lastly say that one of the things that Merck did in that regard is that we invested $500 million 10 years ago in avoiding preventable cases of maternal mortality. Because it turns out that most women who die in childbirth or shortly thereafter, those cases are preventable. And most of that death rate is in places like Nigeria and Kenya and places like that. So we've decided to invest in developing thermostable drugs that can be used to prevent hemorrhaging. And we've also trained about 300,000 workers in Africa. They're not all doctors. Many of them are not doctors. Many of them are midwives. But to impart the skills necessary, and we're very proud of, is that 13 million women now have had access to good care in childbirth. Now that's still a small number compared to the large number that there are, but that's an example of a public-private partnership that we've entered into with the governments in that country. Similarly, with respect to, speaking of women in childbirth, the issue around contraceptives and the availability of contraceptives is another one of these things where we can partner with governments. So to answer your question, I think it comes down to public-private partnerships. I don't think American companies or European companies, Chinese companies will ever by themselves be able to create the resources there, but I think that with government cooperation, we can begin a start there. Thank you for your question.
Okay, this side.
Good evening. First of all, thank you so much for such an insightful discussion that we've had here. I am Shreya. I'm an international student from India. Listening to the discussion, especially the first part where you talked about the scientific challenges you faced while researching for the vaccine production, how you failed a lot of times and then partnered up with other companies, I was reminded of an incident back in India. So I was there when India was facing the Delta variant, and it was not a good experience because of such a huge population and India still being a developing country. If I'm not wrong, Merck did collaborate with the Serum Institute of India for the production of the vaccine. So on the news, we saw how the CEO of Serum Institute of India, Adar Poonawala, if you would definitely know, yeah, of course. He was facing a lot of controversies from a lot of pressure from the government and the Indian people because the company was doing a very good work of supplying the vaccine to the entire world, like so many countries. But the pressure that they were facing was that being an Indian company, they were not supplying enough to India because of the huge population and the number of cases that we were facing. And there was a lot of pressure on him, and finally, I think he had to flee from the country. I'm not really sure, but that is how bad it was for him from the political side and the social side. So what I was just wondering was if you had to face such social pressure or political pressure during that scenario, because all of us agree that the COVID period was very intense at that time, and Merck being such a huge corporate company, if you had to face any incident during your time as the CEO or in the company, what learnings did you get from it, and any lessons that you would like to tell us students for our life, as a leadership role? Yeah.
Well, thank you for the question. Fortunately, I never had to flee the country, but I did feel a lot of pressure. And a lot of the pressure isn't from external. I just have to make this point that at Merck, we're competing for the best scientific talent in the world. And if we don't show people, bright young people who have MDs and MD PhDs, that our values are consistent with their values, they don't have to work at Merck. So, when we develop an Ebola vaccine, we're never going to make any money off an Ebola vaccine. But you know what it's really good for? It's good to recruit the next generation of scientists because they say, hey, they're willing to work on this. I talked about maternal mortality. That's all very helpful. So from our perspective, we want to make sure that with Serum Institute and others, we actually license life-saving medicines and vaccines for use in India. But the point that you made is a very important issue because someone asked earlier about who should pay for drugs. It is fascinating that India, which is the country that has the greatest amount of generic manufacturers, we know many poor people in India don't have access to the WHO's list of essential drugs. Because at the end of the day, those Indian companies, they have to raise capital. They have shareholders. They have to have a return on their investment. So most people will say to me in the UN when I'm walking around the UN, we should get rid of your patents because that's why people are dying in Africa. And I remind them that in most African countries, other than South Africa and a few in the northern part of Africa, we never file patents. So it's manifestly incorrect that IP is the problem. The problem is most big problems in the world need to be solved with business working in partnership with government. And if you don't have that partnership, government can't do it because they don't have the intellectual talent that business has. They don't have the researchers I have. I can't do it myself because my shareholders won't let me do it. They won't let me give away all their resources. So that's where the public-private partnership, and I'm glad you asked the question because it sort of is the dovetail to the last question about Americans paying for drugs. Indians can't afford generic drugs, even though they're the country that produces generic drugs for the rest of the world. Thank you.
One more, I'm sorry.
Sure.
Any incident during your time in the company that taught you a very important lesson of life that you would like to share with us. Thank you so much.
My job every day is to make a decision about how I allocate capital. Am I going to allocate capital in a way that is going to alleviate human suffering today? Or am I not going to allocate it because I need to invest that in the R&D that's going to alleviate human suffering 20 years from now? So what you just asked is an everyday question here, right? So we just faced it with respect to this pill. We have very high hopes for this pill, which is called Molnupiravir. But one of the things I'm most proud of is when we announced that we had the success, at the same time, we announced that we were making it available through qualified generic companies to 100 low and middle income countries. Now, some people would say you shouldn't do that because that's a waste of your resources, that's a waste of our capital. But at the end of the day, you've got to do the best you can to optimize access for suffering people and provide an adequate return for your shareholders. I have to say the one thing that I've learned is that there's no inconsistency between having a return for investors and having a return for society.
I think we have time for one more.
Thank
Thank you, Mr. Frazier, for both your work at Merck and for your philanthropic work. I have two questions, actually, that are related. First has to do with the cost of drug development itself. If one looks at the amount of money that's spent by the federal government on basic and clinical research, the amount that's invested by venture capital groups, and the amount that's invested by the pharmaceutical industry, huge amounts of dollars are going into research and development. Yet the return in terms of truly new chemical entities is going the other way. So I was wondering, notwithstanding breakthroughs like immunotherapies like Keytruda, or what we saw with the COVID vaccine, if you might be able to comment on that. And the second question I had relates to your point about mental health. Neuroscience is broadly, psychiatric and neurodegenerative diseases are now the largest economic burden in the healthcare space. Yet the amount of money that's being invested in research for drugs in those areas is actually declining across the major companies. And I wonder if you might comment on that as well.
Yeah. So on the first issue, the big challenge that the pharmaceutical industry faces is the one that you just identified. The cost of developing each new drug keeps going up, and the return in the marketplace keeps going down. And at some point, you worry that the risks become asymmetric compared to the rewards, and the capital markets will no longer find this to be something that they're willing to do. The good news is I believe we are at a golden age of biology. We just talked about the revolution that we had in physics in the 20th century, allowing us to make semiconductors and spaceships and satellites and everything else. I think we're on the verge of doing that in biology. And I think if you look at the amount of venture capital that's going into these biotech companies, they believe that too. On the question around neuroscience, I do think that's a challenge. I think within the whole sphere of biology, the whole issue around the human brain is something that we don't understand very well. And then the concept of the human mind, as distinguished from the human brain, where with some of these mental illnesses, is a challenge. At Merck, we see this as something we want to be all in on. Both neurodegenerative diseases like Parkinson's and Alzheimer's, as well as things like anxiety, schizophrenia, things of that nature. So we think that there's an area of great breakthroughs. The challenge in our business is, when you look at something great like the mRNA vaccines, it drives me crazy when people say, look how quickly those vaccines were developed. That work goes back to the 1970s. And when you see a disease like COVID addressed, or Parkinson's, or Alzheimer's, or diabetes, the analogy I have in my head is of like a seawall with waves crashing against it. No one wave will cause that seawall to crumble, but the cumulative waves, which is the cumulative scientific inquiry over time, you'll cause that disease or that seawall to be actually crumble or to be cured. And so I just hope that while we deal with the access problems, we don't forget that if we don't have fundamental investment in basic science at the government level, and if we don't have the kind of investment in applied science at the industry level, then our children and our children's children won't have the cures that they deserve. So thank you for the question.
Okay, do we have another question, or? Yes. Yes, please.
My name is Jorgo, and I'm an international student from Ethiopia. Thank you very much for your conversation with us. And I wanted to ask, what is the obligation of a company like Merck in addressing the problems within the US, for example, that cause people to have sickness? For example, you mentioned food deserts. In addition to that, there are chemicals that, for example, warehouse workers are exposed to on a daily basis, and that causes them to be sick. And in addition to that, in household materials, like PFAS or micro plastics or something like that, there are a lot of things that are causing people to be sick that are preventable, whether it's by policy or other things. But what is the obligation of a company like Merck, a life sciences company like Merck, in addressing these kind of issues? Is it just up to a foundation like the one that you have, or is it also up to Merck?
So I want to go back to this concept that I've talked about a few times today of shared responsibility. When I go to work every morning, I can't start to think about how do I prevent all the sources of disease in this country, because I have to find solutions for diabetes. I have to find solutions for Alzheimer's. As a citizen in society, I have an obligation that's no different from anybody else's in this room. At the end of the day, we're the richest country on earth, and we treat a subset of our population poorly. We still believe in this country, for example, that children's education should be a function, to a great extent, of their parents' ability to afford real estate that's proximate to good schools. If you want to run a country that way, then you're going to produce lots of people who are undereducated, who can't reach their full potential. Those people tend to suffer the things that you're talking about, the environmental issues that you were just talking about, the lack of employment, which leads to despair, the homicide problem that we have in Philadelphia with 420 people being murdered so far this year. It's all a result of the environmental factors. And I can't say that as the CEO of Merck, I think I can fix all those things while maintaining a business. But I do have a responsibility as the CEO of Merck to speak out on those things. And I think that as a society, we need to think about it. I made reference to the fact that, that we use prisons to house people who are mentally ill. 80% of the people in prison have been diagnosed with a mental illness. And by the way, when we release them, just in case you think that this 17th century technology called a dungeon is the way to treat those people, they reoffend 7 more times in their lives. So the system is completely broken. And we've got to treat those people in our society who are disadvantaged, who are minorities, who are disfavored, differently. You know, I heard a story last night. I was at a dinner, and one of the leaders of United Arab Emirates was there talking about how they dealt with COVID. It would have embarrassed any American to hear how organized they were about it. We talked about what happened in February and March, how they went out and procured masks for the whole population, how they procured tests for the whole population, how they vaccinated the whole population. Now you might say, okay, there are only 15 million people in the United Arab Emirates, but it doesn't mean that they didn't have leadership, right? We can't all have a crown prince like they have in UAE, but the fact of the matter is we haven't had the kind of leadership in this country that convinces us that we're responsible for one another. And that's where your issue comes down to, the chemicals that people are exposed to. You know, we heard the story about Flint, Michigan, and the lead in the water. That's a crime. That shouldn't happen in our country, right? It shouldn't happen that people who grow up in certain neighborhoods have no fresh food for 20 square blocks. And we can't expect people there to raise their children in a healthy way if that's the case. So I have to answer your question by saying, do I have an obligation? Yes, I have an obligation because I'm a citizen. I don't have an obligation as a capital allocator to allocate my shareholders' capital to fix all of society's problems. So thank you.
Okay, one more question. Go ahead.
Hi, so you talked about a number of issues today, like mental health, incarceration rates, access to healthcare and education, and of course, like Merck can't, accomplish all of those feats and challenges, but how do you choose which of those issues to prioritize, and then how do you choose to prioritize them, I guess?
So I'll use the example of the $500 million we put up for maternal mortality. So first of all, we had, I say had past tense because we spun off a business called Organon recently. We had the largest women's health business of any pharmaceutical company. So somebody just asked a question from Ethiopia. When I traveled to Ethiopia, I was able to see the challenge they have around child brides, these young girls who are forced into marriage and conceive children before their bodies are capable of delivering the children. And so there are huge issues associated with that. So as we travel around the world and start to see the fact that most examples of maternal mortality are completely preventable if you had the right protocols, if you had the right agents, if you had the right training. We said, okay, if we're going to be in the women's health business, we need to take responsible for the idea that no woman needs to die in childbirth. So that was sufficiently related to our business that the people who are already working in those fields of contraceptives and fertility and vaccines and other areas could work on it. And so our scientists were able to come up, there's a real simple regimen made up of a generic drug called carbetocin that's used to prevent women from bleeding out when they have children and they have hemorrhages. The problem with that drug before was it had to be refrigerated. So we said, well, why don't we come up with a thermal stable version that could be used in Africa, Southeast Asia? Because it's a really good drug if you have access to a refrigerator. So that's the kind of thing that makes sense because we were already in women's health. In areas like research, again, we take about 10% of our research budget and we dedicate it to neglected tropical diseases. Which diseases? Well, we look at where the science is most promising to make an intervention, like malaria, river blindness, things of that nature. And I'm very proud that one of our scientists won a Nobel Prize 5 years ago for the work he did on river blindness, which is a terrible disease that affects people in sub-Saharan Africa. So, we try to find the places where there's an overlap between unmet medical need and our expertise. And that's the place where we ought to intervene.
Well, I have to say a huge thank you. Thank you to all of you for attending the 2021 Donald M. Gruhn 49 Distinguished Speaker Series. A very special thanks to Don and Judy Gruhn, whose continued generosity makes this series possible. We strive to expose our students to thought leadership from around the world. And Don and Judy, we could not do it without you. I know you're watching, so please accept our thanks. I also have to give a big thank you to our student, Shalvi Singh, who did a great job moderating today. And of course, thank you to Ken Frazier for joining us today, for giving us so very much to think about. And I hope all of you take this back, apply it to the classes that you're attending, and ask the hard questions. I think that that's one thing that we all learned here today. We have to ask the hard questions. So thank you and have a great evening.